Hello, everyone. My name is Christopher Manko.
I'm Stephen Graham.
It's nice to meet you all. Today, we're going to be presenting a case report on a cardiac fibroma. So let's begin with an introduction. What are cardiac fibromas? These are a rare type of tumor that grow in the myocardium. They typically are found in children. Today, we present a case report of an 83-year-old patient that presents with a cardiac fibroma. This patient originally presented with squamous cell lung carcinoma. However, upon further imaging, a heart mass was detected. This heart mass was then determined to be a cardiac fibroma. Given the patient's past medical history, however, surgical intervention did not occur. Rather, clinical observation and repeat imaging studies were done.
Okay, so in here, in figure 1, we have some CT images, A and D being in the T1 orientation, and C and B being in the T2 orientation. And here in A, we can see the cardiac fibroma in the left ventricle here, as well as here in B, this area that I'm circling in C, and then finally here in D. And then in figure 2, we have 3 MRI images of the tumor, and you can see that in A, that mass in the left ventricular wall here. Image B probably being the most clear image of the 3 of the mass there. And then finally in there. So as Chris mentioned, secondary tumors are far more common than primary. In adults, most commonly, cardiac fibromas arise from metastasis from another organ system to the heart, whereas primary tumors are far more common in children. Clinical symptoms will vary greatly from asymptomatic all the way to being lethal, causing cardiac arrhythmias, leading to asystole. Currently, there's no standardized treatment plan, probably due to the fact that cardiac fibromas are so rare. There hasn't been no standardization of how to approach them clinically, but surgical and pharmacological interventions have taken place with varying levels of efficacy. In conclusion, we presented the case of an 83-year-old patient with a cardiac fibroma. As mentioned, cardiac fibromas are far more common in children, so due to the patient's age group, this is a unique case of a mass in the left ventricular wall. Imaging, this study does go to show that imaging is a vital component of medical investigation to reach a proper diagnosis. Thank you, everyone.